Hi, everyone. Welcome back to another episode of Ask a Care Manager. My name is Ryan Abrevsky. I'm the Business Development Director, and I'm joined with Teresa Jackson, our Director of Care Management. The both of us work for EasyLiving. We're a home care and care management agency serving the Tampa Bay area for over 20 years. The Ask a Care Manager videos are brought to you by Senior Living Resource Magazine and their website, SeniorLivingGuide.com. It's your one-stop local and statewide resource for all things senior housing and health. Anything from home care, like Easy Living, to assisted living facilities, to memory care, to senior health and care management. Check out Senior Living Resource Magazine, which I got a copy of it right here, and their website, SeniorLivingGuide.com. All right, Teresa, hello. Welcome back to another week. Thank you again for your time as always. So I'm sure you saw this week, and all of you out there in Facebook land and YouTube land, I had the honor of interviewing Mary Daniel. And Mary Daniel is now a nationwide, I guess you like to call her a celebrity, but she's, I would say more of an advocate for the realm of senior living and senior health care. So just to give everyone a little bit of backstory who haven't seen that video yet, Mary, her husband was, some time ago, was diagnosed with early onset Alzheimer's. So he was placed into a memory care facility. Prior to COVID, Mary would be there every single day for dinner to spend time with them after work, eat dinner with him, get him ready for bed, and get him into bed, and spend every single night with him. As the COVID pandemic continued to evolve, eventually there was the national and state mandate that unless you worked in a senior living facility, you were not allowed into the building. So Mary was trying to think of any way possible to be able to see her husband and to be able to not just see him through a window or see him through an iPad, but to actually physically interact with him and see him and hug him and, give him that face-to-face and connection with him. Because of the Alzheimer's, it's hard for sometimes those individuals to, interact with their family members on a digital or through a window situation. So Mary started, calling around, trying to make some noise, and eventually her husband's facility allowed her and offered her a dishwashing job as a part-time 2 days a week that she happily accepted that it was her option into the building. So now Mary, 2 days a week, at nighttime after work, goes and washes dishes. Once she's done washing her dishes and doing her shift, she goes and visits her husband and gets to hug him and see him. And it was just an absolutely incredible story. And this led Mary to create a Facebook group called Caregivers for Compromise, Isolation Kills Too. Is that the correct, terminology?
Yes, because, Caregivers for Compromise because isolation kills too. It's a phenomenal Facebook group. And you talk about Mary starting a real grassroots effort here she has. And one of the things that she talked about in your interview, which was really great, was her meeting with the governor and other officials to get some action. And I was listening to that interview, and as interviews go, everybody talks about what needs to be done and we've got to do this and we've got to do that. And you could tell they were about to wrap up the interview. And Mary was like, well, wait a minute. We need to do something. Mm-hmm. And that kept the conversation going. And the governor asked, well, what do you recommend? And it's like, they should have just started with that from the beginning. But Mary was able to talk about some options that they are doing in other states, which is an essential family caregiver designation, where, that person has to abide by all the protocol that a staff member going into a facility has to follow. And it can't just be, all the family members can be designated that. If a family member was going in, like Mary was, providing essential services to her loved one pre-COVID, then if she could get that designation, and then she can go in and continue those services and to be able to visit. I don't know, you've probably had an opportunity, and for all those watching, if you get an opportunity to get on that Facebook page, Caregivers for Compromise Because Isolation Kills Too, and just look at some of the stories, they'll break your heart. But it's a platform where they're able to share ideas. And, some of the questions, Ryan, I think we would actually be able to help with. They're talking about, what do I need to do if I want to bring mom or dad home, or my spouse home, or my loved one's in an assisted living facility and we can't go in. And I know right now here in our area in Florida, we are able, EasyLiving as a home care provider, we are able to send caregivers who have been tested and will get tested on a regular basis at the facilities. We're able to send them into facilities to provide additional care. And we put, for example, and we're doing this with several clients, part of that care plan for the caregiver that we're sending in is to sit down and FaceTime with the care manager or the family members, send pictures to the family members through our secured systems that we have for our caregivers. So, but it's a wonderful, wonderful Facebook page, again, because it is a true grassroots organization that's getting something done, hopefully.
Absolutely. And they have over 8,000 members. And it's just incredible. And like you said, it is sad to hear the stories, but it's amazing to see all these people coming together and forming one voice. And, a task force was created, and Mary's on that task force. And she mentioned to me in my interview, like, we haven't had a meeting yet. We need to have a meeting now. This cannot wait. These people have gone probably 120 days plus without interaction with family members and having people inside those buildings. And again, and I'm sure you hear this too, Teresa, these buildings are just as frustrated too.
Yes.
Because, someone like Mary, and Mary's, pre-COVID going into the facility and taking care of her husband, she wasn't alone in family members doing that. There was a lot of family members who that's one less person that facility really kind of had to deal with. They knew Mary was coming in every single day. They knew Mary was getting him dinner and taking care of him and putting him to bed. So, not to say they're not taking care of him, but that's just one less person they had to worry about, and they could focus their care on some other individuals who maybe didn't have those family members coming in.
Exactly.
So, and the facilities are frustrated too, because they're running out of activities. They're running out of ways to entertain their residents. They're running, it is a frustrating point on inside the buildings and outside the buildings too.
Exactly. And every day somebody posts a story about their loved one passing. And that's the urgency. I think one of the most heartbreaking stories on there was a family member or a family who could no longer go in and see mom. They were sending cards and letters and care packages. And this wasn't in our area. And the facility was saying, oh, she loves the card. She loves the care packages. Well, mom passed away. And they returned all her belongings. And in the box of belongings was every card and care package that they had sent, and not one of them had been opened. And I mean, that just brought tears to my eyes, because, so they were obviously upset beyond words to think that their mom had no idea that they were sending their love and wishes and prayers. And so something has to be done. I mean, there's no perfect scenario on making it safe. Another one of the stories was, they allowed the guy to come in to clean the fish tank because the fish were dying. Excuse me, why? My mother's dying. Why can't I come in and help?
Absolutely. And, I know Mary is trying to move this forward with the governor. And she also told me too, they're eyeing Washington. They're working with other states throughout the country too, to band together and get this, to the federal level of the government too, because, I'm sure you've seen this too in that Facebook group. You see before and after pictures. You see pictures right before the pandemic, and then you're seeing pictures of their loved ones now. And it's absolutely devastating to see the difference in what this isolation is really doing to these clients. And I think you're seeing this mentality, like these people are like, we need to get our loved ones out of those facilities. Yeah. And again, it's no fault of the facility, but just limited to a capacity. We're not saying that it's their fault, but they're just limited on what their abilities that they can do. But I think people are starting to say, I just need to get my loved ones home and get them out of there. And, there might be an option to look at something like home care services. Exactly.
And you see some of those posts as well. Look, I brought mom home a week ago and look at the difference. Look at the difference. And it's going to be different for every situation, and not everybody can bring a loved one home because it is hard. It is difficult. But again, Easy Living, we provide the home care. We provide caregivers that can come out and assist with, bathing, dressing, feeding. A care manager can sit down and go, okay, let's go through what you need to bring mom, dad, your spouse home with you. Because it's a major decision. And, nobody thought that this would last this long when it was originally a 2-week, lockdown, and now it's months. So to entertain those ideas, you definitely need to sit down and speak with a care manager or someone that has gone through this, bringing family members home, helping families caregive for families in their home. Everything from, if someone has dementia and they're wandering and might be exit seeking, how do you lock the doors so they can be safe? How do you set up that home, dementia proof that home? So that's what a care manager, an aging life care manager, can help with. Yeah.
And you like you said, you can help with the planning process, and the home care side can help with the execution of getting everything set up. So, if there's anyone out there who's kind of contemplating that situation, like we both mentioned, there's a couple different options we can help with. Either A, we can send it, get set up to send our caregivers in the building and provide that one-on-one care with your loved one, or B, talk to someone like Teresa and our care management team to plan about maybe possibly bringing someone home and getting them set up for home care services. So again, we'll post all the links for Mary's story and the Facebook group, Caregivers Are Compromised Because Isolation Kills Too. We'll make sure to tag that so you can see their Facebook page. And again, if anyone has any questions, please post them in the comment section below, or you can send us a private message or reach out to us on our website, and we'll make sure to take care of you and get those questions answered.
Yeah, and Ryan, let me just add, the regulations are not allowing our caregivers to go into nursing facilities. It's just assisted living facilities at this time. And even though the rules may state one thing, a facility, a community, assisted living community still has the right to set their own rules and regulations above and beyond what the state might be requiring. So we are in communication with all the facilities that we have, where we have caregivers. We're making sure that they are getting tested on a regular basis, just like they are the staff members from those facilities. And we'll do whatever we can to help the families that are in need at this time.
Absolutely, absolutely. Well, Teresa, thank you again for the great conversation. And thank you, everyone else, for joining in. We hope to see everyone next week. And have a great day. Thank you.
Thank you.